Hello and welcome to today's presentation. Today we are looking at casting in pediatric patients. So casting is one of the intervention for musculoskeletal disorders, especially the fractures. So let's look at it and what it entails. So if you try to define what casting is that this is the application of a hard mold that normally encases a body part, usually an extremity, and with the aim to provide immobilization of the bones and the surrounding tissues. Hard mold that encases a body part. So it can be used to immobilize injuries, including the fractures, prevent or correct orthopedic conditions such as deformities. Also, it can be used to promote healing and early weight bearing after general or plastic surgery, ambulation, or nerve or and vascular repair. It can also used to support, maintain, and protect realigned bones after surgery and immobilize a body part so as to reduce pain caused by motion. Casting can be maybe constructed by use of three items. We could have plaster, where this is presents the majority, odd fiberglass, and synthetic materials. So each has an advantage over the rest, but generally you find that plaster is the one that is commonly used, okay, because it is inexpensive, it is non-toxic, it's non-flammable, and it's easy to mold for healthcare providers, and it rarely causes allergic reaction or skin irritation. Fiberglass is as the second one, and this one is it has an advantage over the plaster in that this one is lighter, stronger, and it's more resilient than the plaster. Okay, it dries rapidly. Okay, this could be drying even within 1 hour or so. It's drying, but this one it will require to take a whole of 24 hours, yeah, for complete drying. Um, so this one is more difficult to mold, yeah. So this is a disadvantage when compared to the plaster, but it can bear body weight immediately. Okay, it can bear the body weight immediately as compared to this one, because this one takes more time to dry, so it might not support the weight. Okay. So we also have other splinting materials, and they are less common. We could be having the malleable aluminium, the air splints, the vacuum splints, or preformed splints. Casting should be performed by a practitioner, okay, with an RN preparing the child and equipment and assisting during the procedure. Although in some cases you find that the nurse may apply or change a standard cast after fracture has been reduced and set by an orthopedist. Okay, great. So what are the types of the cylindrical casts? As you can see here, we have a hanging arm cast. Okay, this one is supporting the forearm and part of the arm. We also have the shoulder spiker. It has a support bar. You can see this, the whole of this part is covered for that. We also have the short arm cast. Remember, this one was hanging arm cast. So the short arm cast is supporting the hand and the forearm. Okay, yes, the hand and the forearm. We have a long leg cast, part of the foot, yeah, tibia, fibula, the femur. Short leg cast covers the foot and the lower leg, yeah. The shin, correct. Single hip cast. This one is the covered area in this case. Then we have the long leg hip spiker. These are two areas that are covered. You can see the 1% is left out. Then we have the abduction boots. Okay, guys. So these are the different types of cylindrical casts that and can be applied. What are the indication of casting? Okay, the major indication is usually fractures. So casting is commonly used to treat fractures, which this could be breaks or cracks in bones. So when a bone is fractured, a cast is applied to immobilize the affected area, preventing movement and providing stability. This immobilization helps in aligning the bone's fragments, promoting proper healing and preventing further injuries. We have orthopedic deformities as number 2 indications. Casting can be used to manage or correct orthopedic deformities, which are abnormalities in the shape or alignment of the bones or joints. So by applying a cast to the affected area, pressure is exerted on the specific points, promoting gradual realignment of the bones and joints over time, thus correcting these orthopedic deformities. Number 3, we have promotion of healing in specific areas. So casting may be used to aid healing in certain areas, such as after amputations or surgical repairs of nerves or blood vessels. So in these situations, a cast may help protect the surgical site, reduce movement, and provide a controlled environment for healing. Indication number 4 is protection of postoperative areas. So after surgical procedures involving bones, joints, soft tissues, casting may be used to protect and stabilize their surgical repairs. Okay, so it prevents excessive movement, reduces the risk of disrupting the repaired structures, and supports the healing process. Lastly, casting can also be used to support and stabilize the weak joints. Okay? Because casting has proven to support and stabilize joints that are weakened due to injuries or conditions, such as ligament tears, okay, the sprains, and the strains. Okay, a link will be popping up. You can review the difference between strains and sprain. Okay, so by immobilizing the joint cast, a cast always reduces the stress on the weakened structure and facilitates healing. Could you be having contraindications? Yes, contraindications are there. People with skin diseases, okay, skin diseases. This one may compromise skin integrity. So applying cast in this area could exacerbate these skin conditions and lead to complication. So proper assessment is crucial before casting to prevent further skin issues. Another contraindication is peripheral vascular disease, and peripheral vascular diseases involve poor blood circulation to the extremities. So casting can potentially worsen this condition by further reducing blood flow. In such cases, proper circulation must be considered to avoid potential complication. We also have people with diabetes mellitus. Diabetes can impair wound healing and increase the risk of infection. So a cast can potentially cause pressure points, leading to ulcers or sores. So managing diabetic related factors such as blood sugar levels, wound care is essential when considering casting. Those patients with open or draining wounds, casting over open or draining wounds can introduce infection and hinder wound healing. Okay, so a sterile environment is necessary for healing. So casting in these situations could be detrimental. Patients with overwhelming edema, severe swelling, can impact the fit of a cast, potentially leading to complication. It's important to address the edema before applying a cast to ensure a proper fit and prevent circulation issues. We also have susceptibility to skin irritation. So some individuals might have sensitive or easily irritable skin that could react negatively to the material used in casting, be it the plaster or the fiberglass. So this could result in discomfort, allergic reactions, and skin breakdown. So how do you perform the procedure of casting, guys? Of course, we need to have the timeout where you verify the child's identity, at least using two patient identifiers. You could have the name of the patient, okay, and also the date of birth for the patient. The parent will also be there to support you. You prepare the cast material as ordered. The RN then begins preparing the equipment by gently squeezing the packaged casting material to make sure that the envelope don't have air leaks. Humid air can enter the leaks and cause plaster to become stale. So, which this could make it to set too quickly, or form lumps, or fail to bond with lower layers, or set a soft friable mass that may not be effective in applying casting. You need to follow the manufacturer's direction for water temperature when preparing this plinting material. So usually we normally use a tepid or room temperature water is best for plaster. Okay? Whereas cool water is used for fiberglass casts. You need to note and record the child's pulse, capillary refill, neurological status distal to the site. Remember to carry out this neurovascular assessment. Okay? Thank you. So after carrying out the neurovascular assessment, you need to apply appropriate dressing to the abrasions and other wounds. Then help the practitioner to position the limb as ordered so that you should note the limb is usually immobilized in a neutral position. Okay? Correct. So support the limb in the prescribed position while the practitioner applies the tubular tourniquet and the padding. During this casting procedure, you need to ensure adequate padding of the fracture site, especially over the bony prominences. However, you need to take care to avoid excessive padding around the fracture site because it can result in an improperly applied cast that does not provide sufficient immobilization. You also need to ensure that the tourniquet, if used, extends beyond the ends of the cast to pad the edges. If the child has an open wound or a severe contusion, the practitioner may decide not to use a tourniquet. The practitioner also wraps the limb in padding with a layer of overlapping the preceding layer by approximately 50%, starting from the distal end, applying extra padding to the distal and proximal ends of the cast as well as any points of the prominence. Then you need to check for wrinkles as the practitioner applies the padding. We don't need to have those wrinkles. So how do you prepare the plaster cast? You place a roll of plaster casting on its end in a bucket of room temperature water, immersing it completely. So do not use regular sink to moisten plaster casting material. Why? Because this plaster will block the plumping. So we don't need to use this. You don't need to use this. You can use a separate one. So when air bubbles stop rising from the roll, you remove it. You gently squeeze out the excess water and hand the casting material to the practitioner who will begin applying it on the extremity in distal to proximal fashion. So you start from the distal end heading to the proximal fashion. So as the practitioner applies the first roll, you prepare a second roll in the same manner. You stay at least one roll ahead of the practitioner during the procedure. After applying each roll, the practitioner smooths it to remove wrinkles, spreads the plaster into the cloth webbing, and then empties air pockets. So plaster splints, if used, are applied in the middle layers of the cast. So after applying the first few layers of the casting tape, the practitioner molds the cast. If necessary, uses the palms and heels of the hands. Don't use the fingers, okay? Yes, because for the fingers, the healing will be uneven. Okay, the drying will be uneven. Okay, so use the palms and the heels to maintain their alignment. Also, before wrapping the last roll, the practitioner pulls the ends of the tubular tourniquet over the cast edges to create a padded ends to prevent casting crumpling and reduce skin irritation. The practitioner uses the final roll to keep the ends of the tourniquet in place. What about the fiberglass cast? If you're using this one, you use activated. This one is water activated fiberglass. You need to immerse the top rolls in cool water for around 10 to 15 minutes to this, and this is just to initiate the chemical reaction that causes the cast to harden. Okay, then you open one roll at a time and avoid squeezing out excessive water before application. If you are using light cured fiberglass, you can unroll the material more slowly. It remains soft and malleable until exposed to ultraviolet light, okay, which sets it, okay. So the practitioner applies the fiberglass roll in just the same manner they do for the plaster cast. What about if you are preparing this synthetic casting material? You immerse the roll in cold water. Remember the cold water, and also for the fiberglass, also cold water. Okay, and squeeze it 4 times to ensure uniform saturation. Remove the material dripping wet from the bucket and hand it to the practitioner. The practitioner follows the manufacturer's direction for preparation and application, which may vary according to the type. So, like for the case of the knitted fiberglass fabrics impregnated with the polythene resin, they are easy to use, mold, they are lightweight, they are strong, radiolucent, and porous. Some contain a lubricating agent in the resin that produces a slippery feel when exposed to water. For the other synthetic casting materials, they have a micro polysat. So this backing can be stretched during the application. The backing allows the material to conform to the body contours and reduce the risk of constriction. Okay? What are the complications of casting? The first one, there are burns, saying that prolonged exposure to casting materials and heat sources can cause thermal burns. Okay, so somebody is at risk of the thermal burns. You also have the compartment syndrome. Excessive pressure within the cast can lead to restricted blood flow and tissue damage. Okay, the 5 P's. Okay, great. Now we have the compression neuropathy. So pressure on nerves within or near the cast can cause nerve dysfunction and pain, resulting into compression neuropathy. Pain can also be a complication, and we have these pressure points or improper fit or swelling under the cast can result in discomfort and pain. We also have the disuse syndrome. So muscles and joints can weaken due to immobilization, leading to loss of function. So when you'll be removing the cast, you may notice that the leg that had a cast might be smaller than the one that didn't have the cast. Okay, majorly due to the disuse. But with the time, with proper nutrition, you normally regain. Okay. Thank you. So we have infection as another complication. So we have moisture or foreign materials trapped beneath the cast can create an environment conducive for infection. Joint stiffness. So there is lack of joint movement during the cast. So this can cause stiffness in the adjacent joints. We also have muscle atrophy. So immobilized muscles can atrophy or weaken over time. Then you have palsy. Nerve compression or damage within the cast can result in temporal or permanent paralysis. The 5 P's, guys, we are having issues with them here. Next, we have paresthesia. So pressure on the nerves can lead to abnormal sensations such as tingling or numbness. What about the foot drop? There is lack of ankle movement can cause the foot to drop downward, affecting the gait and function. Okay, so we have be having excessive plantar flexion. Okay, excessive plantar flexion. Guys, a link on the anatomical movements will be popping up. You can look at it and see the different anatomical movements where you'll be able to see how plantar flexion is demonstrated. Next, we have vascular compromise. So excessive pressure can impair blood circulation, leading to potential vascular diseases or issues. Thrombosis can also result, and this is due to reduced mobility and blood flow. Okay. Ischemic myositis. So muscle tissue can become damaged due to reduced blood supply. Yeah, ischemia. Pressure necrosis. You have persistent pressure on specific areas can cause tissue necrosis or damage. We also have misalignment or non-union of fractured bones. So we have poor immobilization or inadequate alignment can result in bone healing complication. Lastly, we have skin breakdown and pressure injuries. So friction and pressure can damage the skin, leading to pressure ulcers and bed sores. What are you supposed to do before the procedure? You need to perform hand hygiene. Okay? Hand hygiene. You need to explain the treatment and its preparation to the child and the family or the caregiver for that matter. When teaching the child, you make sure you're using age-appropriate language and anatomically correct dolls or puppets if appropriate. You need to consult the child specialist to provide age-appropriate instruction and support, also based on the milestones, okay, that have been achieved. You need to complete a prepare procedure verification process to verify the correct procedure is being performed for the correct child at the correct site. If possible, involve the child and the parents in the verification process. You need to ensure that all relevant documentation, related information and equipment are valid. If plaster is being used, warn the child to expect a sensation of warmth as heat builds, okay, under the cast due to the chemical reaction between water and plaster. Begin explaining aspects of proper cast to the child and the family to assess their knowledge level. Also cover the appropriate parts of the child's bedding and gown with linen saver pad. Remove jewelry from the affected extremity and give it to the family. Assess the condition of the skin in the affected area. You need to note redness, contusions, open wounds to make it easier to evaluate any complaints that the child might have after the application. So if the child has an open wound that requires suturing, prepare a local anesthesia as indicated and clean the wound. Assist the healthcare provider with wound closure and dressing application. Ensure that the affected body part is in proper alignment and establish baseline measurements, because these ones are going to be, we are going to assess the prognosis and how the child is improving based on these baseline measurements. You need to assess and record child's neurovascular status. You need to palpate distal pulse, assess for the color, temperature, capillary refill time of the appropriate fingers or toes, and check the neurological functioning, including the sensation and motion in the affected and unaffected extremities. What about the post-treatment after the procedure? As necessary, you need to cushion pressure points and protect the cast edges using such methods as petaling with waterproof tape to reduce roughness. Also, until the case is completely dry, you need to handle it with the palms of your hands, okay? When moving the limb to prevent these indentions in the cast, okay? Yes. Also, you use a cast stand or your palm to support the cast in therapeutic position until it becomes firm to touch. Okay, usually 6 to 8 minutes for fiberglass. Fiberglass casts. This will be the period between 6 to 8 minutes. But for the plaster, it's within the 24 hours. Okay, so this one helps to prevent indentations in the cast. Place the cast on a firm, smooth surface to continue drying. You place the pillows under the joints to maintain flexion if necessary. Remember to check the circulation in the casted limb, palpate the distal pulse, and assess the color, temperature, capillary feel of the fingers or toes. Determine the child's neurological status by asking about paresthesia in the extremities or decreased motions of the extremities and covered joints. Remember to assess the unaffected extremity in the same manner so as to compare your findings. You elevate the limb above heart level with pillows or towels, okay? And this is just to facilitate venous return and reduce edema. Remember to never use the bed or table to support the cast as it sets because molding can result because pressure necrosis of the underlying tissue. So you make sure you have a pillow for that. Don't put it directly on the table and on the bed. So prepare the child for X-ray as ordered by the practitioner to ensure proper aligning. Also instruct the child family to notify the practitioner if there's any pain, foul smell, there is a drainage, or there is a burning sensation under the cast, or there is swelling distal to the cast is excessive. Okay. Appropriately dispose of materials. Pour water from the cast bucket into a sink that contains a plaster trap. Okay. Monitor for changes in the drain pattern and provide care aimed at preventing skin breakdown near the cast and averting the complication of the immobility. If a cast is applied after surgery or traumatic injury, remember that the most accurate way to assess bleeding is to monitor the child's vital signs. Okay? And B, you need to ensure that a visible blood spot on the cast can be misleading because one drop of blood can produce a circle, yeah, of about 7.6 centimeters in diameter. Okay, so it needs careful examination. A cast may need to be opened to assess the underlying skin or relieve pressure in certain areas. So in that case, we normally have a windowed cast and a bivalved cast. A windowed cast, here the practitioner normally cuts a specific area of the cast as it hardens in order to allow inspection of underlying skin or to relieve pressure. Okay, so we can use this one to inspect the underlying tissue. What about for the bivalve casts? So this one is split medially and laterally. So this one creates anterior and posterior sections so that one of the section may be removed to relieve pressure while the remaining section is used to minimize and to maintain immobilization. Okay, and this one is best done where we have the joints. When the joints are involved, we'll be having the bivalve cast. Also frequently turn or assist the child. So you turn every 2 hours while the cast is drying, especially when you are using the plaster. Okay, every 2 hours you turn for us to have even drying. Correct. Assess the child neurovascular status changes every hour for the first 24 hours. So for the first 24 hours, we need the 5 P's. Also, encourage the child to remove about as normally as possible after the cast dries. So after the cast dries, you allow the child to move as freely as they can. Okay. So you need to be alert for the complaints of pain. Do not assume that pain is related to the underlying injury. Pain may suggest compartment syndrome, which we have listed as one of the complications for this matter. You need to notify the practitioner if the child complains of persistent pain. Okay, so let's look at the child and family teaching. So on child and family teaching, I say teaching should be family centered. Okay, involve the family in as much as possible, and be sure to include the family or caregiver when appropriate. You tell the child and family that fiberglass cast dries about an hour. Within an hour, the fiberglass will have dried. But a plaster extremity cast will take about 24 to 48 hours, whereas a plaster spiker or a body cast will take 3 days almost, 48 to 72 hours. Explain that during this drying period, the cast must be properly positioned to prevent a surface depression, the indentions that could cause pressure areas and dependent edema. Emphasize the need to keep the cast in good condition. Okay, it should not be wet. Okay, yes. Explain to the child and family on how to monitor drainage, the condition of the cast, and the affected limbs' neurovascular status. Instruct them to immediately call the practitioner if any of the following signs and symptoms occur. That is increased pain or and a feeling that the splint or cast is too tight, numbness and tingling in the hand or foot, indicating that will be indicating too much pressure on the nerves, burning and stinging, indicating too much pressure on the skin, excessive swelling below the cast, or loss of active movement of the fingers or toes. You need to encourage the child to elevate the affected limb to reduce swelling, okay, and we elevate above the heart level. You need to inform the child and the family that after the cast dries completely, it looks white and shiny and is no longer feels dumpy or soft. Okay, yeah. Then you need to advise the child and family to keep eyes on the cast for 20 minutes after every 2 hours while the child is awake to help minimize swelling. You also need to advise the child and family to continue the recommended exercise to maintain child's muscle strength to avoid disuse. Also, before discharge, teach the child and family how to care for the cast. Tell the child to keep the cast elevated above the heart level to minimize swelling. You need to raise the cast, okay? Raise the cast. You need to instruct the child and the family to call the practitioner if the child can't move the fingers or the toes or has numbness or tingling or has a fever of about 38 degrees Celsius, that is equivalent to 104 degrees Fahrenheit, or unusual pain, this drainage or foul odor from the cast. Okay? So let's look at now the patient teaching aids. Okay? So we're saying that when while addressing the patient, you say you need to think of your new cast as a temporal body part. Okay, so one that needs the same attentive care as the rest of you. Okay, so while you wear your cast, please follow these guidelines. So guidelines on speeding up drying for a newly applied cast. So your healthcare provider may apply a cast made of plaster, fiberglass, or synthetic material. The wet material must dry thoroughly and evenly for the cast to work properly. Okay. To speed up drying, keep the cast exposed to the air. Okay. Avoid wrapping the cast. You only wrap the cast when you want to maybe take a shower. Okay. When you want to support the cast with pillows, make sure that the pillows have rubber or plastic covers under the linen case, okay? Place a thin towel between the cast and the pillows to absorb moisture. Never, never place a wet cast directly on plastic. Guidelines on helping the cast dry evenly. Remember the first one was fast. Need to dry, speed up drying. Just put them in the air, okay? Air dry. What about if you want it to be done evenly? Here we are saying we are going to be supporting it using our palms and heel and not our fingers. And we are going to do it, turn it every 2 hours. Okay. You can also have someone to move the cast for you, but they should know what to do. So this is how you support the cast. Okay. So to avoid creating bumps inside the cast, which could cause skin irritation and sores, don't poke at the cast with the fingers while it's wet. Okay? Also, be careful not to dent the cast while it's wet. Guideline on keeping the cast clean. So after your cast dries, you can remove dirt and stains with a damp cloth and powdered kitchen cleaner. Use as little water as possible and wipe off moisture that remains when you are done. What about on protecting your cast? What are you supposed to do? You avoid knocking your cast against any hard surface. Okay? To protect the foot of a leg cast from breakage, scrapes, and dirt, place a piece of used carpet over the bottom of the cast. Slash or cut a V shaped at the back of the carpet so that it fits into the heel. When you bring it up towards the angle, okay, hold the carpet in place with a large sock or slipper sock. Then extending the carpet out beyond the toes a little can also help to prevent bumped and stabbed toes. So this is how we do it, applying the V. Okay, and applying the V here, the V-shaped carpet. Okay, what about preventing snags? So smooth rough edges of the cast with an emery board. So never cut the cast with scissors or attempt to break off rough edges. Do not pull out padding from the inside your cast. This is what most people do. Please you don't need to do this. To keep an arm cast from snagging clothing and furniture, make a cast a cover from the old nylon stocking. You need to cut off the stocking toes and cut a hole in the heel. Then pull the stocking over the cast to cover it. Okay. Extend your fingers through the cut off toe end and poke your thumb through the hole you cut in the heel. Okay. You need to trim the other end of the stocking to about 4 centimeters longer than the cast and tuck the ends of the stockings under the cast edge. Okay. So this is what we are doing here. Okay, then you apply it. On caring for your skin, you need to inspect the skin daily for irritation. Okay, wash the skin along the cut edges every day using a mild soap, and then before you begin, protect the edges with a plastic wrap. Okay, you don't need to wet it. Then use a washcloth wrung out in soapy water to clean the skin at the cast edges and as far as you can reach inside the cast so that you avoid the cast getting wet. Afterward, you thoroughly dry the skin with a towel, then massage the skin at and beneath the cast edges with a towel or a pad saturated with rubbing alcohol so as to help to toughen the skin. You need to prevent skin irritation, remove loose plaster particles that you can reach inside the cast. You only use rubbing alcohol 2 to 3 times a day and do not use it if the skin is cracked or open. Okay, yes, Alcohol is it will dehydrate the cells. So removing itching or relieving itching. So no matter how itchy the skin under your cast may feel, never try to relieve the itching by inserting a sharp or a pointed object into the cast because it could damage the skin and lead to infection. Also, don't put powder or lotion in your cast or stuff cotton or toilet tissue under the cast edges because this could reduce circulation. So a safe technique to use to relieve itching is to set a handheld blow dryer, okay, on a cool setting and aim it down the cast towards the problem area is where you're blowing. You can also use a cold pack on the cast over the area. So you place a thin towel between the cool pack and the cast to prevent accidental getting the cast wet. So you can use the dryer and then you point it towards the area where there is a problem. Then you blow it. Yes, it can relieve the itching. Okay. What about keeping the cast dry and drying it if it gets wet? Yeah, there are instances where your cast is going to get wet. What are you supposed to do? If you have a plaster cast, you will need to cover it with a plastic bag before you shower or swim or go out in a wet weather. You can also use a garbage bag or a shower bag, which you can buy at a drugs or a medical supply store. Above all, don't get a plaster cast wet. Moisture will weaken or even destroy it. Okay, so if the cast gets a little wet, let it dry naturally. You can sit in a sun, okay, and then don't cover the cast until it's dry. If you have a fiberglass or synthetic cast, you need to check with your healthcare professional to find out whether you may shower or swim. If the practitioner does allow you to swim, you will probably be instructed to flush the cast with cool tap water after swimming in a chlorinated pool or in a lake. So make sure that no foreign materials remain trapped inside the cast. To dry a fiberglass or a synthetic cast, you first wrap the cast in a towel. Then prop it on a pad of towels to absorb the remaining water. The cast will air dry for like 3 to 4 hours. Okay. If you put in warmer areas, it could result into burns. Okay. What about maintaining proper nutrition? Saying that you need to consume a diet that is high in fiber, okay, fresh fruits, vegetables, and this is majorly to prevent constipation. You also need to increase fluid intake to prevent kidney stones and constipation. On mobility and exercise, you need to adapt activities of daily living to your abilities such as possible to maintain independence. As you move around, watch for toys, throw rugs, and small pets to reduce your risk of falling. What is the advice on clothing? You need to wear loose clothing. We normally say approximately 2 sizes larger than your normal wear, with no elastic around the helm, wrist, ankles areas. So you need to wear clothes that can help you stay as cool as possible because the cast normally make your skin produce more heat. Okay. We also need to advise them on reporting problems. Immediately contact the healthcare provider if they cannot move the fingers or toes, if they experience numbness, if they have signs of infection, or they feel warm over the area of the cast. They note there is a drainage. Okay? Yes. There is always this issue of signing on the cast. Some family members and friends may want to sign their names or draw pictures on the cast. That's okay. But don't let them paint over large cast areas, because by doing so, this could make those areas non-porous and damage the skin under it. Warn the child and the family not to chip, crush, or cut or otherwise break any area of the cast, and not to bear weight on the cast unless instructed to do so by the healthcare provider. Inform the family and the child who has a cast on the dominant arm that the child may need to help with bathing, toileting, eating, or dressing. Okay. So what about the removal of the casts? Okay, okay, we have the indication for the removal. We could be having a cast damage or a pressure injury under the cast, excessive drainage, bleeding, or cast constriction. All right, so guys, so this is how you do it. You do it on one side of the cast, then next you do it on the small side, other side of the cast, then finally you cut using a cut scissor, and you will be able to have removed the cast. Thank you so much, guys. You can be able to access the free quiz in the description section of this video, just to test your knowledge on this and reinforce your understanding.